Hi there, my name's Monique de Beer and I am a registered physiotherapist. I've decided to start doing some weekly vlogs, video logs, whatever you call it, to just chat about what I do in my practice, discuss conditions that I'm seeing, give advice where I can, as it's quite hard on a public platform like this to just randomly dish out advice, because I've not seen you in person, I've not assessed you, and I don't know your unique circumstances, because most of what I do is specifically tailored to the individual patient that I'm seeing, and having discussed things with you and knowing what your goals are, etc., etc. But I would love to just tell you a little bit on an ongoing basis about what I do, how I do it, interesting things that pop up, maybe discuss some articles that I've read, the latest research and so on. So I hope you guys will join me on this journey. The first one that I'm actually starting a blog series about as well on my website is the question of, well, not the question, but the topic of physiotherapy rehabilitation. So rehabilitation is quite a broad term, and it can encompass anything from rehabilitation after alcohol or drug abuse, physical rehabilitation after a stroke, speech rehabilitation after a stroke, rehabilitation after any kind of injury, whether it was for sport or just some random event. So rehabilitation is quite wide. So physiotherapy rehabilitation specifically is aimed at the physical getting back to normal, the physical getting you fit again and getting you working the way you should be working. So there's various fields. I look at rehabilitation after surgery, which is quite a big one that I'm dealing with at the moment. Quite a few people coming through after they've had an operation and they need to get back on their feet and get back to safe, normal function. Then there's physiotherapy rehabilitation after any kind of injury, whether you stepped funny and twisted your ankle or something more serious. There's rehabilitation of the elderly, for example, where they have coordination problems, weak muscles, balance issues, things like that. There's rehabilitation after a sports injury, which is obviously the sports people, they put their bodies through a lot. They pick up anything from a little niggle all the way through to torn ligaments or even broken bones. There's rehabilitation after a car accident. So there's numerous areas in which physiotherapy rehabilitation plays a role. Even something like cancer rehabilitation, which a lot of people don't think about, or that's not a mainstream function of physiotherapy. So I want to be discussing all of this as I see it, and keep you posted through my blogs and my website. So I hope you'll join me on the journey. Keep well, we'll chat soon.